We had called to order previously and we'd gone into closed session, so now we are at approval of agenda. So I'll entertain a motion to approve the agenda. And well, hang on just a sec before we do that.
Yes.
Tim, are we expecting?
Yes, I'm just texting him right now.
Okay, the bond counsel. Okay.
Yep, Gary Hicks. Yeah, I contacted him earlier and he was going to be on the call.
All right.
The what counsel? Excuse me, Ross.
The Gary Hicks, the
Financial consultant.
Oh, okay.
Told them about the bond.
The bond.
To explain
Okay.
the bond resolution.
My life, when you say bond, you have to put emphasis on the D. Otherwise, my head goes elsewhere.
Not like Robert or Tony.
Yeah, exactly.
Okay, so let's if we can reorder the things on the agenda, then we'll move the bond counsel item up following the consent agenda.
Assuming he's on the call.
Assuming he's on the call, yeah. So before all the reports, then we'll
The two new business items?
yes, the two new business items. So if we can make that change, then I'll entertain a motion to do that.
Okay, I'll entertain a motion to move items 1 and 2, the two resolutions under new business, ahead on the agenda after the consent agenda.
He may have just joined us.
He did just join.
I'll second that.
Thank you, John. Thank you, Jean. Okay, then any other discussion on this? Okay, seeing none, then John, your vote.
Yes.
Jean, your vote.
Yes.
Barbara,
Yes.
Charlie,
Yes.
and I'm a yes. So we have an approved agenda. And flag salute and invocation. Barbara, would you lead our flag salute tonight, please?
Yes.
Thank you.
I'll stand, face the flag, place your hand over your heart.
I actually have a flag in my office.
I pledge allegiance flag of the United States of America and to the
republic for which it stands, one nation, under God, indivisible,
with liberty and justice for all.
Thank you, Barbara. Mark, would you care to do our invocation tonight?
Absolutely.
Thank you, sir.
Heavenly Father, as we come before you this evening to discuss items related to the Board of Directors and to the hospital district, we ask that the decisions made tonight are following your will and your guidance. We praise you and we love you in Jesus' name. Amen.
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 Thank you, Mark. Okay, item D, the closed session report. Is that you, Scott?
Yes. In closed session, the board considered one claim of potential litigation upon motion by Director Bush, seconded by Director Blythe. The board unanimously rejected the claim. No other items were discussed and no other action was taken.
Thank you, Scott. Okay, we're on the item E, public comment portion. This portion of the agenda is set aside for any member of the public to be heard on a matter under this board's jurisdiction, but not on tonight's agenda. Do we have any public comment?
Can I comment on Chet's fan?
Chet doesn't have any fans.
Good comeback.
Is that Chet? Is that Chet's office? Must have.
Yeah, he's got his iPhone sitting on his desk and it's showing us his ceiling fan.
That's
falling in. Look at that.
Oh, you're seeing the gnat. Okay.
Oh, there you go. All right. Now put it back to the fan, quick.
Yeah, back to the fan, please. Thank you, Chet.
It's hilarious.
You're starting
Okay.
to look suspiciously like Dr. Finstead. Yeah.
All right, we are at item F, the consent agenda. And the consent agenda all the items on the consent agenda will be approved in one motion unless any member of the board or member of the public would like an item taken off the consent agenda and discussed on the regular agenda. So do we have, does anyone would like to pull an item from the consent agenda?
I'll be on policy and procedures and going over the majority of this. I went over it earlier today. I have no issues with what's on there, so I would motion that we accept the consent agenda as written.
Hold on a sec.
Yes.
Hold on a sec. I believe, Director Elliott, are we going to remove Alta Sierra from this agenda and move it to January?
Yeah,
Certainly.
that was my intent. I just didn't get a chance to throw that in there.
All right. Very good catch. Thank you.
Yeah, I would like to just pull that item and we'll revisit it in
I will recuse myself from that, certainly.
Okay. If we just table it, then you don't have to recuse yourself. So I'd like that just pulled and tabled until 2021.
All right.
So could you restate your motion?
Then, with the adjustment regarding the one item, I would move that we accept the consent agenda as written.
Thank you, Charlie. Do we have a second?
Second it.
Thank you, Gene. John, your vote?
Yes.
Gene, your vote?
Yes.
Barbara?
Yes.
Charlie?
Yes.
And I'm a yes. Okay. Thank you all. Which brings us to Gary Hicks. Is he, Gary, are you on?
I am. Can you hear me?
I can hear you great. So we have moved
Wonderful.
the two items, the two new business items, the two resolutions regarding the bond matter to this point on the agenda so that you don't have to be on our meeting for any longer than what you need to be. So we'll start with Resolution 20-04, authorizing the commencement of proceedings in connection with the proposed issuance of refunding revenue bonds and retaining of a financial advisor and bond counsel. And I'll turn this over to Tim.
Tim?
Tim,
you're muted. You're muted, Tim.
Gotcha. Thank you. Thank you. That's good because I was saying it all wrong anyway. So anyway,
Get a duel.
as part of our strategic planning process, one of the items that was identified was an opportunity to try to begin finding additional sources of funds that we could use for our construction project for the seismic upgrades and also the infrastructure repairs that need to be made. And Chet and I reached out to Gary Hicks. We had talked about a year or so ago, actually engaged Gary to begin looking at the possibility of restructuring our debt. And so we discussed this and basically came up with a plan that we presented at the board building and planning committee the other day. And we again agreed because we did not want to bring the resolutions forward at that point in time without the board having an opportunity to sit and think about these. We made the decision to bring them back tonight. And so again, what I would maybe like to do is, this is a resolution. I'll let Gary go through the details of it because he's much more eloquent with presenting this than I could ever be. And so, but the idea there basically is to kind of help pay off some of our existing debt and to provide some additional cash value for us that we can apply towards our project. And with that, Gary, if you would take it over, I would appreciate that.
Tim, thank you very much. I'd be more than happy to. And thank you for allowing me to go a little bit earlier than on the schedule. Thank you very much for that. But as Tim indicated, this is a resolution that's very much preliminary in nature. Matter of fact, we call it a preliminary resolution. A similar resolution went before your same board about a year ago when, as Tim indicated, we had kind of started this process on a refinancing and restructuring of your outstanding debt with Cal Mortgage about a year ago. So this is simply a update of that resolution. It allows for a refinancing of that Cal Mortgage debt, both the outstanding bonds as well as what they call the Heathcliff loan, which is the insurance program for Cal Mortgage. And it includes an additional financing of new money for new projects in an amount not to exceed $5.5 million. So this is different from a year ago, in that a year ago we were just looking at a refinancing only. Now we're looking at a refinancing and about $5.5 million of new money. As Tim indicated, that would be related. The new money would be related to the building programs for the district, as well as some purchase of some equipment and a building as well. So that would be included in that. The resolution does indicate that it authorizes the district to prepare documents associated with the issuance of debt. It does not authorize anyone to execute those documents. So this is not a commitment in any way for the district in taking this action. It just starts the wheels moving and the process moving forward. The process takes about 2 months, 3 months to go through the process. And so this allows us to get to that point where we can move it forward. At the point in time, if we do have a bond issue with an investor purchaser that would be under terms and conditions that would be favorable to the district, we would bring it back to the board, most likely in December or January, I would assume, for approval at that point in time. But this is not any commitment. It also authorizes the CEO and the CFO to work with me as your financial advisor, if you so engage me, to move forward with various other documents like term sheets and Appendix A's and requests for terms, things that are necessary to move this process forward. That's in Section 2. Section 3 engages me as your financial advisor and engages under Section 4 the law firm of Quinton Timig to act as bond counsel for the district. Sections 5 and 6 set forth that other board members, the board chair, first vice chair, and second vice chair, as well as the CEO and CFO, can take other actions necessary to be able to, again, move the intent of this resolution forward, which is simply to take the next step necessary to see if there are investors at terms and conditions that would be acceptable to the district to move forward with the financing of the new money of $5.5 million and not to exceed again, and the refinancing the outstanding debt. This financing would contemplate that Cal Mortgage would not be involved in the financing, and that it would be sold and underwritten or privately placed based upon the credit strength of the district and not with the support or guarantee of the Cal Mortgage program. I'll stop at that and see if there are any questions that anyone has with respect to that first resolution.
The question I've got is the description of the project. I'm confused on what stage of the project. It says 5.5 million. We've got a 19 million project going here. And so where's the 5.5 coming from? It almost looks like we're deceiving someone.
Gene, hey, Gene.
No.
New money.
Gene, wait just a sec, guys. Isn't that on the second resolution?
No, it actually is also included on this first resolution. So if you look at the first whereas, so the first paragraph under the heading says resolve. The second one says whereas. It does say to fund up to 5.5 million in new money. The reason why it's at 5.5 million, for two reasons actually. One, we think at this point in time that would be an amount that probably would be acceptable to investors, and that we would be able to get acceptable terms and conditions from investors or purchasers at the new money of 5.5 million. Because when you add that to the refunding amount, we're talking about a total financing then of about a little over $11 million. The second reason, which is probably the most important reason, is the fact that there's an Internal Revenue Service code or regulation that limits you to be able to finance projects that will be expenditures. The expenditures of that project will be incurred within the next 3 years after issuance of the debt. The majority of your project will not be expended within the next 3 years. And so we simply don't have the authority under IRS tax code to be able to issue tax-exempt obligations that are expected to be incurred over longer than a 3-year period.
Okay, I understand. So I'm okay. Thank you.
Sure.
Any other questions on the first resolution?
No.
Okay.
Can I make a motion that we accept it?
Thank you, Gene.
I will second. Or John.
I heard you. Okay, we'll take John.
Okay.
And
you always did like him best.
Is there a discussion or any other questions? Okay, then we'll vote. Director Bush?
Yes.
Director Casas?
Yes.
Director Parks?
Yes.
Director Blythe?
Yes.
And Elliot is a yes. All right, Gary, explain to us what the second resolution is.
Sure, that's resolution number 20-05. The title of that resolution is a resolution of the Board of Directors of Kern Valley Healthcare District expressing official intent regarding certain capital expenditures to be reimbursed with proceeds of an obligation. And that may be a bit of a confusing introduction to this resolution, but basically what we call this is a reimbursement resolution. And what it authorizes the district to do, it doesn't require it to do anything, but it allows the district the flexibility that if it pays for certain project-related expenditures that would be financed with that $5.5 million of new money, and it elects before it issues a debt to pay cash for those expenditures, it allows it to be able to reimburse itself for those cash expenditures. It goes back 60 days before today's date if you approve it. So it allows it to go run back 60 days before and up to the date of the issuance of the bonds. It doesn't need to cover things like architectural and engineering fees and other soft costs because those don't require it. But hard costs or capital expenditures, things like a purchase of a building or the purchase of equipment would need to be covered by this. And again, it's because of a certain IRS regulation that does not allow you to reimburse yourself from the issuance of a tax-exempt obligation, a bond issue in this case, unless you have this official intent to reimburse yourself for it. So this simply allows flexibility for the district to, if it so desires, to reimburse itself from the issuance of these tax-exempt obligations for cash expenditures before, so that it can, again, replenish its cash reserves from the proceeds of a debt obligation. Everything in here is really for the purpose of meeting tax counsel, in this case, Quentin Timming, who is acting as your bond counsel. When they issue a tax-exempt opinion, when the bonds are issued, this resolution gives them the information they need to give you a clean opinion issuing a bonds if you so elect to reimburse yourself for some of your capital expenditures. And that's really all it does. So the language in here may be somewhat confusing because it meets the requirements IRS code, but it's only with respect to reimbursement issues. And we put certain dollar limitations there, like the $5.5 million, because that's the maximum amount that we have in the preliminary resolution and that we expect to expend. So this covers us for the maximum amount that we have, not that we ever would expect to reimburse yourself for the full $5.5 million, but it provides for the greatest flexibility. We would never want to shortchange you on that. For example, if we thought that the reimbursement was $1 million and it came out to be $1.5 million, this would limit you to only $1 million. We wouldn't want to limit you to that. So that's why we put the $5.5 million in the project description in Exhibit A is there again for the bond council and their opinion to cover the areas that they need to have. So this resolution has been reviewed by bond council and has been actually drafted by bond council along with my input and others, and is for that purpose and that purpose only. Again, this does not commit the district to anything. It simply allows it flexibility if it so elects to utilize it. Any questions?
Chet, does that
Yes.
sound good? You're the one who would know. Well, everything you just said, do you agree with it?
Yes, I do.
Okay. That's my question.
So you know, just to help you a little bit, I'm up at Southern Inyo. They actually took a bond issue to pay out their bankruptcy and other items as well on their, as far as retrofitting their hospital a little bit. And I'm already doing this with the trustee. So I've already asked for some reimbursement up there because they have been funded.
Okay, do we need a motion or is it?
I have one question before we go to a motion. Scott, is this an appropriate time perhaps, since this resolution is talking about the building that we're purchasing? Can you give us just a quick update on that purchase?
Yeah, so the escrow was originally scheduled to close last Friday, but we're having a little issue with obtaining the title report, nothing in the title report, but getting the title report. As of today, the title report was supposed to come in this afternoon, so we will have some time tomorrow to take a look at it, and we should be able to close the transaction on Friday.
Thank you.
This is also, we did get the estoppel agreement signed by the church.
Oh, good.
So.
Oh, good.
Okay.
It's good news.
Are there any other questions by any member of the public or the board regarding this resolution?
Just a comment. So you know, not only the building, but also the $337,000 that the California Energy Commission is holding back from us that we paid last month. I plan on putting both of those on a request for reimbursement.
Oh, good.
Oh, good.
Kim, you're muted.
Kim, you're muted.
I can see you talking, but we can't hear you.
I was just asking Susie if she could put her phone on mute because we're getting some background noise. That would be helpful. Thank you.
Should I make the motion now?
Yes, please do, Gene.
All right,
Thank you.
Gene.
What are you talking? Saying muted?
I didn't hear him.
Not you, Chet.
Go ahead, Gene.
Okay, I make the motion that we accept
Okay.
what we were just talking about. I can't backtrack everything.
Resolution.
Resolution 2 or well,
There shouldn't be. There's nothing on my screen. Shouldn't be anything. Not
It's not you, Chet.
It wasn't you, Chet.
-05.
I didn't know.
Okay, that was a cluster. Can we start over with the motion?
Okay, the motion, what is that, resolution 2?
20-05.
Okay, I make a motion we approve it as presented.
Yes, I'll second.
Thank you. Director Blythe, your vote?
Yes.
Director Parks?
Yes.
Director Costas?
Yes.
Director Bush?
Yes.
And I'm a yes. Okay, both resolutions are approved unanimously. Thanks, Gary. Anything else,
Thank
Tim?
you, Gary.
Thank you, Gary.
Have a good
Thank
night.
you very much. No, nothing else to report. Thank you so much.
All right, drive safely.
Thanks.
All right, so that brings us to item G on our agenda. And we have a foundation report. Do we have a foundation report tonight?
Good evening.
Debbie.
I just want to let you guys know that the hospital's doing a drive-through flu shot on Friday, and we've been advertising that this week and last week. The foundation is holding its diabetic cooking clinic. It'll start this Saturday for the next 3 Saturdays. We've limited the class to 6 and we'll do the social distancing. We've contacted each individual and they're good with that. So we're excited about that. We have enough folks that we could do a second class probably in January. Again, we're going to limit it to 6 folks. And then the activities committee is doing a KVHD Thanksgiving food drive, and we've invited the community to join us. So those are some of the things we're working on. Any questions? That's my report.
Thank you, Debbie. Thank you very much. Okay, the auxiliary report.
I will give that report. This is from Cindy. And it's good evening, everyone. Hope that one day we will each be able to see each other again in person. I'm very happy to report that we are doing great. We added another basket of goodies to the Acute Nurses Lounge. We are pleased to say that since its start, that we are money ahead. All of the staff are so honest, they say just keep the change. So we're actually making money on the candy we sell at a profit in the Nurses Lounge and so forth. And it does get visited. The thrift store is amazing. On Sunday, we went down to put out the Christmas ornaments and gifts or decorations and so forth. On Monday, we had our biggest sale ever in our 50+ years. We did a whopping $1,500 in one day. And they were thrilled with that. They also were able to get the VFW to agree to host a Christmas party on December 9th. That's going to be depending upon state COVID requirements at the time. We'll see what happens. But again, you know, in the event that it does get the go-ahead to move forward, that the hospital board is absolutely invited to attend and would just notify them in advance to get reservations made. So, so they just keep moving and try to keep earning money down there. Even though they have cut down the number of days that the shop is open, they're still making as much money as when it was open every day.
Yeah.
And so with a lot less work and a lot less drain and drag on the volunteers. And so I think everybody appreciates it much more. So it was a good strategy. And that's their report.
Thank you, Tim.
Thank you.
You're welcome.
All right, the medical staff report. Dr. Finstead.
Thank you, Ross. The Pharmacy and Therapeutics Committee met on October 12th. We reviewed and approved one policy regarding the supervision of advanced practice practitioners. This is related to state legislation that was passed at the beginning of the year, making the supervision of nurse practitioners and physician's assistants basically the same and equitable. We had considered this at the beginning of the year, but the COVID situation kind of interrupted that. But anyway, that's what this is about. The committee also reviewed an update on COVID-19 preparedness issues, along with monthly and quarterly reports, including blood usage, medication error, monthly reports, medication area inspection, medication shortages, and hand hygiene. The Emergency Department Committee met on October 19th and reviewed their statistical reports through September of this year. They also reviewed 2 issues referred to pharmacy and the medication error reduction program regarding changes in documentation for IV drips, along with the use of protocols for those same medications. They also reviewed the use of COVID antigen testing. In addition to that, they reviewed their regular reports, including blood culture analysis, risk and benefits of transfers, ED clinical quality measures. The Infection Control Committee met on October 20th and reviewed and approved a new policy regarding the infection control procedures during an influenza or other novel virus pandemic. Reviewed their regular reports, including employee exposure, hospital-acquired infections for the nursing center, blood culture analysis, clean trace audits, hand washing in nutritional services and elsewhere in the hospital, along with antibiotic usage. The Medical Executive Committee met on October 20th and reviewed the 4 credential files that were on the consent agenda. These are teleradiologists from Kern Radiology in Bakersfield. We also reviewed and approved 2 policies, the ones mentioned from Pharmacy and Therapeutics regarding the supervision of advanced practice practitioners and the infection control policy. We also reviewed an updated information on the current COVID-19 issues. The Utilization Review Committee met on October 29th and discussed issues regarding inpatient laboratory testing that is sent out and comes back after the patient is discharged. They reviewed denials of payment and authorization for admission, along with the patient portal. They also reviewed their regular reports, including utilization review and medical records, ED physician statistical report, and the other usual reports. And that's the end of my report, unless there are any questions.
I do have a question on
Sure.
the protocols for the nurse practitioners and the PAs. Now, what's changed at the state level? Are they independent now from physicians, or how's that relationship?
Well, they're not completely independent. They need to have supervising physicians, but the requirement for chart review, let me back up. And the supervising physician needs to be available, not necessarily on site, but available to the practitioner. The main change was physician assistants were required to have a certain number of their charts reviewed, and they had closer monitoring by the physician. So this really was an attempt to kind of balance that out, make the 2 practitioners basically equal as far as the supervision was concerned.
Thank you, Gary.
No problem. My pleasure.
Any other questions or comments for Dr. Finstead? Okay, seeing none, thank you.
All right, thank you.
All right, and then our Chief Executive Officer report, Tim.
Great. I've got a little bit of data to present tonight. So I'll start off quickly with just COVID. Just again, obviously our community testing is continuing. Since last month, we've tested 288 people within the community with only 2 positive patients, which is a great positivity rate. Again, it's been dropping. As a matter of fact, I think the last 3 days that we have tested, last 3 weeks we've tested, we've had 0 positive cases. So again, we hope that trend continues. We again still have no COVID in-house as it relates to any of our staff or our residents or patients. The concerns, I brought this up at some of the meetings, the board subcommittee meetings. Concern is still existing with regards to what's going to happen with the community testing beyond December 31st. I was actually on a conference call with the hospital CEOs from Kern County here just before this meeting and talking about that. And there's still some concern. The state is looking to shut down their 3 testing sites here in the county in November. The county is looking to close theirs at the fairgrounds. And we've been informed that the county is out of money effective December 31st. And that is for all kinds of support, not just for our community testing programs, but they were also supporting a number of the hospitals in the community with providing funding for additional staffing as it related to COVID surge, coverage and those kinds of things. And so there's obviously a lot of angst going on right now. Obviously, we kind of look around what's going on nationally with some of the COVID rates that are happening. Kern County, for some unknown reason at this point in time, has remained very low in its positivity rate, more so than the counties just immediately to the north of us. And when we look at that, the thought was that by the hospital council was primarily because of some of the advanced work that we did in getting the word out on wearing masks and support of the hand washing and those efforts that we made it through each of our hospitals, that we have seen a curtailment in our communities that's continuing to this day. So the concern obviously moving forward from here is the flu coming in now along with COVID and what's going to happen with that. You know, so we're all kind of waiting at this point in time to see what the state and the county are both going to do as it relates to continue to provide testing money. The big concern, obviously, moving forward is without that is the governor's made it quite clear that our county's ability to move from one tier to the next tier on that 4-tier business reopening plan, one of those is based on the number of people within the community that are being tested per 100,000 population. And obviously with the state and county shutting their sites down, that's going to make it very, very difficult for them to meet those numbers. So they're still working. There's conversations going on with the state at this point in time, trying to figure out what they're going to do. They've expressed a strong desire to keep ours open least way through August of next year. And I said, certainly willing to talk about that. Obviously, there's got to be money to help make that happen. And so they're very understanding of that. We were also provided relief funds. Again, there was a huge effort being made by the Secretary of Health and Human Services to reword the repayment plans for hospitals and health systems that received advanced payments by reclassifying what counted as lost charges or lost revenue. And so they changed the rules back in mid to late September from what they originally were in June, which is what all was communicated to all of the hospitals when we get into this. And so we reached out to Kevin McCarthy and to most of the state legislature asking for assistance and from, again, from everyone involved trying to get HHS to turn this thing around and go back to the original definition of that. Kevin had a conference call with us to review that and understand how that impacts us. He shared with me 2 days later that he had made a personal phone call to Secretary Azar expressing the concern and the pain and the hurt that this would cause. I mean, you're talking literally billions of dollars that hospitals would have to repay in monies that was granted to them to help cover costs associated with COVID. And so we are pleased to announce that HHS has reversed its plan and gone back to its original design. And so they're back out actually re-educating everybody on how the new definitions will apply moving forward. So I want to reach out to Kevin and thank him for his efforts in assisting us with that. That was a huge part. Again, it was brought up, the flu shot clinic is going to be this Friday. Just a little more detail on that. That will be from 9 a.m. to 1 p.m. out in front of the hospital. There is going to be a second one Monday, but that's not open to the public. It's primarily for the dam workers. And that's going to be on Monday at 1 o'clock. Not sure what the location of that's going to be just yet. But obviously we want to get as many people vaccinated as we can. We've been continuing our efforts on strategic planning. Meetings have begun with the strategic objective captains to begin reviews of each of the each strategy and develop detailed action plans of those. Some of the things we've been working on so far has been new employee newsletter designs, staff interviews for both internal and external communications. This is where we go out and interview new employees who've come on board, and there's photos taken of them, and there's a question and answer thing that's done just to kind of get to know a little bit more about them and where they came from and, how they got here and so forth. It's first seeing the first two that have been done so far, and they're really, really good. And I think it's going to really help get to people to know each other a little better and open up some communication channels. We've begun looking at a new social media software, be more friendly and professional, and working on refreshing our brand and logo for our website and redesigning it so that public relations department can update that without having to contact a third party for assistance on that, which sometimes delays us in getting things up quickly when we need that out there fast. We're also looking at some new internal and external communication tools. We're working on the possible debt refinancing, which we just talked about a little bit ago. It was one of our plans that we're working on. I've also begun working on a visiting nurse program through Mountain View Health Center and possibly a hospice program. We've reached out to the state for licensing requirements on this for both CMS and for the state, for both the hospice and the visiting nurse service programs. So we've already got that working. I think she's already got the application completed for the state licensure on that. And so again, that's in process. We're also working on plans to improve our funding incentives under the pay performance provisions within our managed care contracts. And what this is that there are monies that are made available for certain healthy activities that our physicians will talk with their patients about, obviously smoking cessation. There's a whole host of them. And if you do these things, then obviously you get money back from the health plan for doing these things to help improve the overall wellness of the patients. And so there's opportunities that there's been monies possibly left on the table. And so Greg Davis and his team are working on that, trying to figure out how we can do this and develop some performance indicators for staying on top of these things to make sure that we maximize our efforts for that additional cash. And that can get to be some pretty significant cash over time. So again, something that we're actively working on. Cybersecurity threats is another one that's been a big topic here lately. We received word from the FBI and from the Cybersecurity and Infrastructure Security Agency, which is the main site of cybersecurity crimes against healthcare organizations and government agencies. And so we were made aware of this, obviously, this effort by these cyber criminals to target upwards of 400 hospitals and health systems across the United States to try and lock up their systems. I think there were 6 or 7 hospitals or something that were attacked within a 24-hour period of time. And so, you know, again, one of the things for us, we had just finished our penetration testing of our information systems literally just about a week or 2 ago, and received a great bill of health there that there were only 4 very minor issues that they found in trying to get into our, this is where we have an outside company actually try to hack into our system. And so our systems were working very good, and all 4 of those minor issues have all been rectified. And so as of this moment in time, obviously our systems are looking great. But as we know, criminals get more and more inventive as to how they break into systems and so forth. So it's a constant battle. It's one of the reasons why we do those things, of trying to keep testing our systems to make sure that we're protecting our data and our ability to continue to provide care. I know, was the system, Chet, that got hit the other day was the Community Health Services, CHS. 250 of their hospitals were impacted. Their records were locked up literally for, I believe, a week or 2 or more. Literally could not access their data. And so, again, just something we just cannot afford to have happen here. And so we take that very, very carefully and very seriously. And but just something that we've been getting a lot of noise on in the last 2 weeks here about being careful of what's coming through in the way of mail, in terms of a lot of this starts as phishing things where people will send you an email and say, hey, I've got this for you. These files need to be opened. And literally, our employees have been trained very, very well to question those things. And we test them internally here on a regular basis, trying to trip them up. And so and we put out a report as to who fails. And I've got hit once, but you know, but like I said, usually I'm on top of that, and I'm sending my stuff to Carrie to check it out. Is this you or is this real? And so, but that's what we've got to do now. I mean, it's really what it's gotten down to. And so that's pretty much my report. It's been keeping us busy. So any questions anybody has?
It seems like when we shut down testing, we'll be 0 per 100,000. So that would be a good thing. Everything can open up.
Well, no, actually it works the other way. When it gets to zero, they close everything down. Unfortunately.
Well spoken, Mr. Trump.
Not sure who you were directing that at, but.
Hey, Tim, I had a question.
Sure.
On the funding for the testing, the COVID testing.
Yes.
This item that we've approved tonight on the consent agenda, the BD Max clinical instrument, is that going to allow us to do this internally, our own testing, so we don't have to rely on state funding, or do we still need outside funding to operate that?
The issue is, yes, we could do the testing ourselves. That's what it means. The issue is that we wouldn't be sending it out and incurring the cost to have Quest do this on our behalf. The issue is we'd be paying ourselves, obviously, with that state money. So the money would stay inside, because right now it's a pass-through. Okay. You know, they cover our employee time and all the supplies and stuff that are used, other than the testing. The testing is a pass-through from us directly through to Quest.
Okay.
So this means that we could actually hold that money ourselves, and actually, you know, it's a good thing for us.
I don't know that we would ever use that in a community drive-through setting, though.
No, we have the ability.
There's not enough reagents
and
things.
It could handle the volume and stuff like that, based upon the guarantees that we've been given with this so far, based on the numbers that we're currently running per week. Because it just came with a guarantee of at least 200 test kits a week, and we're not running anywhere near that. But obviously, our first priority is making sure that we've got it for our ER patients and any of our staff here in the hospital and so forth. So the idea is that we don't want to have to wait for these 2 to 4 day delays. Like I said, at the worst, I think it got up to 16 days that we were waiting for a result back from the private labs. So again, and this device will also test for other organisms as well besides COVID. So we'll get some great use out of this machine.
Okay, thank you.
You're welcome.
Any other questions for Tim?
Well, the positivity rate in 4 weeks is less than 1%.
Right.
So I'm struggling with even, you know, through August of next year. It concerns me. If they're not going to pay for resources, that would be a problem.
That's the county's goal, not necessarily mine. But,
well, hey, Mark, since you're talking, let's go ahead and start your report.
Sometimes I talk too much, Ross. All right, so I've created an audit to identify differences in the delivery of healthcare related to bedside nursing care. And I call it Now and Then. And that is, when I was a student many moons ago, we used to have a saying that we were a high touch, low tech type business. It's turned around full circle, and now it seems that we're a high tech, low touch kind of profession. And, you know, there's a lot of people that entered the nursing field many years ago, like I did, that really don't have, they would rather take care of patients than, you know, kind of be saddled in front of a computer. So what I developed was a way to find out how many minutes, you know, the argument begs the question, how has the delivery of healthcare changed since the advent of the electronic health record? And I know it sounds grandiose, but in my little corner of the world, the discussion is related to how many minutes are being spent providing hands-on nursing care versus how many minutes are spent in front of what they've termed and now called the eye patient. So an interesting study to address our continuous quality improvement CQI program and our HCAP scores. So I think it's important for me to kind of get to the bottom of this. I developed a little bit of a tool for one of my nurses who started that process last week. So we'll see how that goes. But I'm kind of interested in seeing how many minutes are spent actually delivering patient care versus what's being required of them to enter data into an electronic health record. So that's kind of the premise behind that study. The next thing I wanted to talk about, visitation for the skilled nursing is by appointment now. The family may visit in the day room as long as they agree to maintain social distancing and follow the pre-screening and masking requirements. The other thing is they can visit in the rooms But they still have to manage just like the staff does, where they are checked before they come in. They're pre-screened, and Susie, if I'm saying something wrong, go ahead and speak up. Visitation for acute care remains on a case-by-case basis. The ER continues to restrict visitors with the exception of parents of young children and those who may need behavioral health or mental health services, or those that are actively in the dying process. We obviously want to help families adjust to that. So the next thing on my bullet point is we've begun our second CNA program. The date of completion is January 5th. I had one more student that dropped the program, and his comment was, "It's not my calling." So he got out to the floor and realized that it's pretty hard work, and that it's not his calling. So he did drop the program. Pardon me. We started a new telemetry program with Randy Fieber, who is the educator in that. I think he has 9 or 10 students right now. That'll be finished up December 9th, and those graduates will be able to monitor telemetry on the med-surg floor. Next thing I want to mention, dietary received their A rating today. Congratulations. They do a tremendous job in there. We're very supportive and happy for that. And the final thing, I was approached, actually Tim and I were approached this morning along with Heidi to there's this push on by someone in the skilled nursing facility to order some lightweight jackets and windbreakers that have a logo on them. So if any of the board members are interested, go ahead and kind of pass your size along to me or to Heidi or somebody, and we'll try to get you a jacket. They're kind of neat jackets, so if you're interested, let me know. And with that, I will open it up to any questions.
Mark, it seems like we save so much money by the nurse doing that. Why couldn't they have a voice to where when they talk, it records automatically? Like if they went in room 22, they say 22 when they go on, it would bring up the patients, all the information and everything they said, which the patient would appreciate them talking about them, would be recorded.
Well, you ought to ask Chad about that one. That requires quite a bit of capital, that level of
that technology is not quite there yet.
Technology isn't there. It's there for the doctors. They get to do that.
Yeah, for dictation.
Body cam stuff.
Okay, you answered my question. Thank you.
Any other questions for Mark?
No.
All right, thank you, Mark. All right, Chet, the Chief Financial Officer report.
Okay, we'll talk a little bit first about the month of September. September was a continuing item or month, I guess I should say, for on a positive side that we've had since the beginning of this fiscal year. Even though we weren't quite as well off as we were in either July or August, we still did keep up the utilization in the inpatient services. It wasn't, and an interesting part is it wasn't really in admissions or discharges, it was in patient days. And we kept, we actually are not supposed to have acute patients over the long haul, over 4 days length of stay. Our length of stay in acute days in the month of September was 12.3. So obviously we were using them with a little bit differently than acute beds, but and then on the other hand, our swing beds was also 12.0, which is about where the maximum it should be. So but we kept patients in there, and because we kept patients in there, we were 30.1% above our budget in the acute patient days, and we were 65.5% above our budget in the swing bed days. We'll tell you that that's not continuing in October. That has dropped off dramatically and we will see the effects of that when I report that month at the next meeting. The outpatient was, had been already all basically fairly robust, but this particular month, we were 10.7% and referred outpatients below our budget. The interesting part about that is a lot of that we were 17.4% in primary care in our clinic over budget, and we were 19.2% over our budget in specialty services care in the clinic. So the clinic did their part. I don't know why we didn't see as many services in the ancillary services from referred outpatients. However, a part of that is the COVID testing that really doesn't bring much to the table except for the test itself. So although it raises the volume in these areas for number of registrations, it does not raise the volume much for revenue generated. Consequently, in that regard, we actually generated $9.5 million in revenue in the month of September. A year ago, before we added 7% price increase, we actually had 9.7% revenue that we generated. Our contractual allowances were relatively the same as a percentage each year. Our bad debts were only about half a percent higher in the month of September than they were in that month in the year before. And we actually ended up almost at a break-even change from budget. It basically was $5,000. So we had the budget of 2.589, and we actually did 2.594, only $5,000 difference than our budget. Last year, the net difference was 2.398. Our expenses, our direct expenses, were 115,000 under our budget, and they were actually about 200,000 over our prior year. And you expect about a 3 to 3.5% inflation factor when you look at that. The place that we actually lost the majority of our efficiencies as of last year were purchase services, which actually ended up with the things that we buy from the outside that have to do with computer programs, et cetera. And so those are kind of climbing on us a little faster than we would like to see. So we hear all these grandiose things about this positive technology. Mark says it's getting away from his hands-on, and I say it's getting away from the budget. So just so you know, I'm on that same bench, just for a different reason. The other area that was doing it is supplies. I said we have a little bit of, that we were about $10,000 over in supplies. That basically continues to be the pharmacy, although they actually were not as, and they were still under their budget, I should say. They were under their budget in revenue generation. So they continue to struggle with that. They're continuing to look at changing their main supplier to see if that helps the situation, because it's a cost of pharmaceuticals problem.
Hey, Chet?
Yes.
Is that the in-house, the in-hospital pharmacy, or is that the retail pharmacy?
That's the retail pharmacy.
Okay, thank you.
Yeah, the in-house pharmacy might be a little higher, but again, we had those patient days in there in the inpatient side for this particular month. But no, it's the outpatient pharmacy.
Okay.
It's the other part that we had was let me, before I get to that, let me say that an operating surplus, we had budgeted just to break even about $204 positive from operations. We actually came up with $120,951 from operations positive. or actually 120,422, excuse me. And the last year, the same month, was 123,265. So about the same type of performance as last year. I'm now concerned about, I may have a major concern about October and November started the same way of what we're going to see there as far as from operations. I firmly believe, and I will predict at this time, it will be a loss from operations. We are covering some of our loss from non-operating. We did have a little bit of non-operating money come in. We had 48,000 positive go towards our profitability. The budget was 11, and the year ago was actually a negative going towards our profitability of about 1,500 bucks. So we ended up the month at 169,003 in profit. Our budget was to make 11,000, and we made 121,000 in the prior year. That brings us to a 3-month year-to-date, fiscal year-to-date of 295,000 positive. 34,000 is our budget. 119 was what it was for the 3 months in the prior fiscal year. So we're about $260,000 ahead of our budget for 3 months, but I guarantee you it's going to catch up. Thank goodness we haven't. As far as anything else is concerned, I said we did still have a good cash month. The cash month, we actually increased our cash on hand, our short-term cash on hand, not including any reserves, by almost $900,000, 893,000. Now, part of that, I must confess, was money coming in from the CEC to reimburse us for money we paid out, about $1 million to train. We got that money back in this month, and it actually is what brought that cash positive in. We actually had a slight increase also in our accounts receivable, about 560,000, which doesn't make me very happy, but we'll continue to work on that. Right now, we're at 80 days. We should be at 50 days. So we have some work to do. Let's see, our investments still, our cash in the LAIF account is just over $9 million, which still has not had to be touched, but we'll see how that comes out in the future. We have left a little money in funded depreciation that we can use to start paying for some of the things. Hopefully we can be reimbursed on some of those things. And I actually am very happy we weren't aggressively pursuing payments in our construction in earlier months, because you only get to go back 2 months. Anything before that, you can't claim for reimbursement. So waiting a little bit actually is going to help our coffers get better, because we're going to be able to take the money out of the project. And I think that's my report, unless there are questions.
I do have one question on page 24 of the agenda packet. This is the executive financial summary page.
Okay.
I note that financial strength index, am I reading this right? We're in the good category now.
Is what? Is it a positive category?
Are we in the good category?
Yes, you are.
I mean, hey, that's a reason to celebrate. Let's open the bottle of champagne.
Yeah, you're right. It's been a negative for a long time.
It's fair now, right?
No, it's up. It's good.
No, it's actually in the good category.
In the good category.
Oh, I see. Fair. Well, it says 0 to -2. You're right. So it's just a little. You're right. It's good. I haven't seen that. I don't think ever.
I don't either.
You know why? Does anybody know why that's true?
Why?
It's actually because of all the money we got during COVID, and it's in the bank and
yeah,
reserve.
That's
the
true.
only reason it's not operations, although they're coming along some of the time, it's actually non-operating money. That's what got us into the black. On good or bad.
I thought it was Gene being treasurer.
Well,
Just tell him it was me.
That would have been my guess too. Yeah.
Well, Ross, that was actually going to be my question, but thank you for bringing it up. But since we're on that same note, so from a financial standpoint, Chad, and also with the refinancing we're doing with the bonds, getting Cal Mortgage kind of out of the picture, is that going to free up our cash position too? Because don't they have assets to our cash if it's so many days or whatever? But that also...
They do have, yes, John, you're right. They do have access to pay off the $6 million. We'll borrow now money to pay that off. And so we'll actually have better use of our existing reserves and cash as well.
Okay, so hopefully that financial strength that Ross was just referring to, hopefully that'll kind of start going up into the future. Do you foresee that happening?
The problem that we still have is a negative equity for all those years in the hospital. Mm-hmm. When we actually borrowed the $21 million in 1991, the hospital, when it closed the books, was actually $7 million negative. In other words, that money that they borrowed, when you take the net realizable value to the equity of what the property is worth, was $7 million in the hole. We're beginning to climb out of the hole. If you look at the balance sheet in the assets section, you'll see that the actual total unrealizable, unrestricted assets are 31 million. If you go over to the actual total sheet, we are no longer actually operating at a negative equity. And that started about a year ago because we had some really pretty good year ends for the last 3 fiscal years. We actually ended with either between $1 and $3 million, and the last one is still being worked on, but I expect it to come out at least $1.5 million positive. So those things took us out of the negative equity that it's taken us almost 30 years to make up.
Yeah. Well, I mean, either way, I mean that's a good thing. I mean, it's definitely great to have a positive net worth rather than a negative net worth. We just have to keep that trend going. But yeah, I mean, it's a pretty big milestone for our district, I think. I remember you bringing it up a year ago that we had finally, turned that point in history, which was really good news.
One of the things that's kind of interesting, John, if you look at the net property, plant, and equipment, it has been increasing a little bit too. It increased 358,000 as of the end of the month of September.
Yeah.
And we actually have a net property, plant, and equipment after accumulated depreciation of $6.2 million. Right. But that still is huge in total. So what that basically says is of the 31 million in accumulated depreciation, we should have set aside just that, 31 million in funded depreciation, so we could have paid for a new hospital. That's what should have been done. Relatively speaking, until the last year and a half, there's been no funded depreciation to speak of. As of right now, there's 2.8 million, and I probably will put a little more in there as we begin to, when that money comes through, we'll set it aside, but we'll have some unfunded depreciation because that's where you should be paying your construction from. But you can see that negative operations and negative equity took away the value of the funded depreciation, which at this point in time have been about $31 million. And it's actually 2 million, almost 3 million, let's say.
Okay.
Just to kind of put it in perspective.
Yeah, but still theoretically, when we start doing the construction improvements to the facility itself, that obviously increases the hospital's net value, correct?
It increases, yes, they will go on the cost. We will continue to put depreciation against that.
Yeah, that's right.
Once the project is finished. In the interim, it will go on you'll see an account here called construction in progress. Right now we have just $3 million in that construction in progress. That's money we already have in the project. That money, as we spend it on the retrofit project, will go in there. You'll see that continue to go up, but you won't see the depreciation for it go in there and be an allowable non-cash expense, because a project has to be usable. Now, if those things we set aside, for example, let's say we were setting aside this generator, there are some things that are gonna wash out of the project and maybe be able to be depreciated. Most things are not.
Yeah.
One of the things that will is the building. The building, although it's an item in the project that we buy, will begin to be depreciated once we occupy it.
Okay.
Okay.
So, Mike,
I
have a question. Can you depreciate that in phases? Like if a phase of the project is done, can you start, once you occupy it, can you start depreciating?
The answer to that is no, you cannot.
Yeah, amortization. Yeah.
You must have a complete project approved separately by OSHPD, constructed separately, and then being it used. It can't just be finished. It has to be being used. You have to occupy it.
Okay. Any other
For example, we over at Tehachapi, we had to wait 2 years for Adventist to occupy it. We still couldn't depreciate it for 2 years.
Okay.
None of that will make any difference, Chet. Tim said we're going to be operating positive, so about $2 million a month, and we'll be able to. Well, close to it, you said. We're working.
I really need to invest in some hearing aids.
Hey, Gene.
Yes.
Do you want to talk about the your concerns about the pharmacy and its financial viability?
We have the most wonderful opportunity to make money in that pharmacy and to have a better image for the hospital. We own the 3 lots there. We could move, the worst case scenario is move that 1970 mobile home, or 79, whatever year it is, down to where it's level where people can get in and out of it without needing stilts or something, and putting a drive-through to where it's convenient. People are going to continue to not want to communicate with sick people. They don't want to go in where sick people are getting medication. So we should accommodate them. And the cost would be so small from the benefit we would get from it. It is unreal that we are sitting there with that pitiful building and the operation. They're restricted. It's like a funnel. They're restricted to what they can do. And so we need to deal with the pharmacy. I'm not blaming the people that's operating it now. They're doing the best they can, but we need to help them do better.
So Tim, are there consultants or experts that can look at that situation for us and give us some advice?
Sure, I'm sure we can come up with that.
Okay, sure would like, maybe Gene's idea of the drive-through isn't something that's viable. I don't know. I have no idea what the answer is, but retail pharmacy ought to be making money, and I'm not sure why we're not.
Well, there's no drive-through pharmacies anywhere around the lake here, so I mean, it certainly would be a first. So there might be some opportunity to pick up some business so people didn't have to go in. Don't disagree with him on that perspective. We'll take a look at it again.
Okay.
We sort of owe it to the community to do the best we can for them because we're sort of their provider. Yeah. And so.
No, good point, Gene.
Thanks, Tim. Thanks, Ross.
Okay, guys. All right. So we have no old business. We've dispensed with the new business. So we'll go to item J, director's comments. And tonight we'll start with Charlie Bush.
Oh, I'd just like to say congratulations, Ross, John, Catherine, and Fred for Catherine and Fred. Catherine, I know you have a lot of experience with the healthcare district, so it's not going to be quite as steep a learning curve for you. But get ready for an onslaught of acronyms, Fred. You're joining a good group of people. I have complete faith, and I will always be attached and always be interested and participating. So I just want to say congratulations to those of you that got the votes to carry on the mission of the healthcare district and carry on.
Thank you, Charlie. Director Casas, Barbara.
Yes. I'd like to congratulate Catherine and our new insurance director, Fred Clark, on their wins, and of course Ross to be congratulated for a term for I guess you'll be on a 4-year term now, or are you on a 2? I don't know.
2.
2 more years. Yeah.
Anyway, it was a good race. I've had a long run, and I'm ready to turn it over. Alan and I are thinking about a location change simply because of his health. We need to be where I have a better handle on his health and a better residence for that. So we probably will be leaving sometime this next year, and I'm hoping that everything will work out for the new building. I'm really excited about that. Love to hear the comments about the people in the community that are excited about it too. I love the new Liberty Ambulance residence on the corner of Heidi's and my street. I was a little afraid of the fence that they were putting up around the house, but it looks like the aesthetics are a little better today. And but all of that aside, it's been a really interesting run. I've learned a lot. I've had a lot of fun. I've enjoyed it, and I'm looking forward to whatever comes in the future for Alan and I. And I thank you all, and especially the executives and the employees who are excellent staff. They are such a credit to this valley and to this unit that is here in comparison to other areas, because they have their hearts behind it. I'm really happy to see that and to leave it in that area. So I thank you, Catherine. I give you best wishes. Of being the only female on the board, it sometimes is a little difficult, but I know you can hold your own. So that's my swan song for tonight.
Thank you, Barbara. Thank you so much. Gene.
I'd just like to thank Charlie. I learned so much from him. I thought I knew everything till I got here on the board. And he and Barbara, has it been since 92, or you've been on the board since 92, I think.
Yes, 1992.
Yeah.
Long time.
That's awesome. Thank you so much. I learned a lot from you. Again, I thought I knew everything, but you taught me. At any rate, thank you guys so much. And congratulations to Catherine.
Heidi knows everything.
And Fred, let's say this else. John was #1. I always knew that he was there. So many times he ran and came so close. But
every time I ran,
he's there.
Dead last.
He's there. It's Awesome. Everybody here is perfect except for Bob Easterday.
I'm perfect.
That's the nicest thing you ever said to me, Gene.
Thank you.
Thanks, Gene. John.
Just reiterating what everybody else said, definitely want to thank Barbara and Charlie for their years of service on the hospital board, and very much looking forward to working with Fred Clark and Catherine when they are sworn in next month and seated in January. So thank you all.
Thank you, John.
And you too, Ross. I'm sorry, I forgot about you.
That's okay. I'm good.
Congratulations on your reelection too, sir.
Thank you.
Director Elliott, may I say one thing? Just one clarifying comment. So you guys will have your board meeting the first Wednesday of December, and then that Friday, the 4th, the newly elected directors will take office. So the first Friday in December, they take office.
I was going to ask that. That's very good. Thank you for anticipating questions.
You got one more meeting, Charlie.
So I'm awfully grateful to the community for having confidence in me to continue to serve on the board. You know, winning the race is exciting, but it's also really, really humbling. And I'm honored and appreciative. And thank you. Thank you for your support. And I ask for your continued support of the healthcare district as we, as a board, as an organization, continue to move forward. I want to congratulate John Blythe for being reelected. You contribute such a great deal to the board. You know, during your tenure, you've amassed a great deal of knowledge, and I'm glad to see that the board will retain that. We'll continue to enjoy your acumen and your understanding of district matters. So congratulations, John.
Okay.
Pardon me. Barbara, you've been on the board 28 years. 28 years you've given to the district your devotion, your interest, and your wisdom. You've always acted in the best interest of the people of the Kern River Valley, and you've contributed a great deal to the board. You have a vast institutional knowledge, and I'm really going to miss that knowledge and your passion. Please join me in thanking Director Casas for her decades of service to this organization.
We wish you the best. All the best to you.
And we're also losing Charlie. Director Bush has been a pleasure to work with.
Thank you.
You've got keen insights into issues, and it's never without your wit and your pragmatic approach. You've made an extraordinary member of the board, and I'll miss you greatly.
Thank you.
Please
fair warning, I may be back. You know.
I hope so. You know, as selected by the voters, we'll be adding 2 new members, Catherine and Fred. Congratulations to both of you. You've got big shoes to fill. And I look forward to working with both of you. Can't wait. The learning curve's going to be steep at first, and don't hesitate to ask questions. Share your thoughts and bring your new energy to the board. Your willingness to serve your community in this capacity is really very much appreciated. I also want to thank Mike Hess and David Fluhart. You know, our democracy works best when people are willing to step up and participate in the process. In giving voters a choice, sharing your ideas and thoughts, and challenging the status quo is vital to the success of the district. So your participation makes us all better, and I commend both of you for your willingness to serve. I hope you can find ways to continue to support the district and contribute in other ways. We welcome you. And I was going to ask about the when the guard actually changes, but Scott answered that for us. So we'll see this board, all of you, back for our December meeting. And then we change seats and play musical chairs in January. So with that, thank you and good night. Thank you to everybody for your contributions tonight, and we'll see you next month.
Thank you, Ron.
Take care.
All right.
Thank you. Good night, everybody.
Good night. Heidi, is Greg out there?
Yes.
Okay. If he wants to come in here, we can go ahead and make that call to Greg, to Scott, rather.
Something going around in everyone's throat.
Tim, just call my cell.
You got it.
I don't know. It's interesting now.
Good night, everyone.
Good night.
People have it.